Hi YouTube. This will be a quick post, although I'll let you know it's taken me 3 or 4 tries to get this. As some of you know, I'm in the middle of an IVF cycle with my wife today, September 4th. It looks like the date of retrieval will be the 8th or the 9th. My wife is responding medically very well. She's got lots of follicles, which means that on the day of the egg retrieval, there'll probably be lots of ovum. I hope. So that seems to be going well. She's not feeling too well. She's pretty nauseous. The shots that she's having to go through is not much fun. She's uncomfortable. She's having trouble sleeping. It's an emotional time for a lot of reasons, and the rush of hormones is not helping. So she's still functional. She's still going to work. My goodness. This is a testing ground, and she's proving herself remarkable. As always, she is. So that's that story. As far as my own story is concerned, as some of you know, I had discussed with my urologist something called a Micro-TESE procedure. If on the day of retrieval I don't produce a sample that they can use to fertilize the ovum, they have frozen samples to try. Although unfortunately in tests, my frozen samples don't survive thawing. So that's kind of an issue. So we were going to have a backup procedure, something called Micro-TESE, where they actually surgically go in to the scrotum looking for viable sperm. It's a procedure that has the highest rate of success for this kind of procedure. When you're got not many sperm and you need something for ICSI, this is a good way to go. And I sort of discussed this as the option, and I told my fertility doctor when I went that this is what the urologist had said. And I've been asking, since I've gone to this fertility clinic, to ask if they've coordinated with the urologist. Because on the day of the procedure, if I don't produce a viable sample and we don't have one on hand, I have to have this surgical procedure. And the urologist does that. So there needs to be coordination between the two clinics. I found out this week that my fertility clinic never bothered to get in touch with the urology clinic. So, 2 years of my life have been focused on what is coming on the 8th and the 9th. This was the best option offered to me by the urologist. I had been surprised that we weren't taking more care to coordinate the date of retrieval with this procedure, but I was assured over and over by the fertility clinic explicitly that they had taken care of the details, that everything was ready, everything was in place, and they just hadn't bothered. Now, my fertility doctor has been supremely confident from the outset that a viable sample would be available. I'm not sure, but I don't think he's actually reviewed my whole record of samples that have been given, the fluctuations in my sample viability, and the tests which showed that the thaws were not successful. But I can't be sure of that. But I don't know that he's reviewed those. And he's just been very confident that no matter what would happen, there would be a viable sample. So there's a rush of organization back and forth. The urologists have agreed to provide a urologist to do a biopsy, sperm aspiration. I'm not sure the exact name of this procedure, but basically they do a biopsy to a small segment of through the scrotum, through a small incision, and hope that they find that what they pull out has viable sperm in it. Its rate of success is lower than a Micro-TESE. So the option provided to me by the urologist, by specialists who have followed me for 2 years, conducted my original surgery, is now just been pulled off the table because my fertility doctor never felt it necessary to communicate with them, despite my asking him to. I'm a little frustrated, to say the least. I hope that I produce a sample that we can use. I hope that if that doesn't work, one of the frozen samples that we've stored is usable. And I hope if that fails, the biopsy produces something. The fertility clinic had said that it wasn't necessary to have a donor. They were that confident. Then, when this happened, they started saying, well, don't worry, we've got some donor samples, on hand in the office, so we won't waste the cycle, So basically, they wanted me to randomly just, somebody would be the father for our kid. So yesterday we rushed and chose from a catalog a donor. Again, I don't know if I'll say whether we have to use it or not, but the lesson to you is you have to be on top of your own treatment. If two doctors are telling you two separate things, you need to square what is going on between them. Do not trust a doctor to advocate for you. Do not trust anybody in the doctor's office to advocate for you. If somebody says, don't worry, we're taking this off your hands, you don't need to worry about it, you make sure that whatever it is they're telling you not to worry about has been confirmed. You have to, and my mom was a family doctor, and she said this, that you have to be your own advocate. And perhaps if I'd taken that more to heart, I wouldn't be in this position right now. But really, I did ask multiple times, and they said that they had taken care of everything, and they hadn't. So I hope everything goes well, but I don't know what to say, because if, for instance, the biopsy doesn't produce something and we need it to, I'll never know that if we had gone for the Micro-TESE option, that something might have been produced. So that's where we are right now. And hopefully it will go well. But really, this is a lesson for you out there who are patients. You're not consumers. I don't like that term. You are patients, but you have to be aware of what's going on. Must clarify with everyone what is going to happen, that all the steps are in place, because no one will do it for you. So that's the situation. And just please take that to heart. Wish us luck. I'll hopefully post before. We've got lots of appointments between now and the date, I think. And we'll see what happens. If there are doctors that ever review this, I'm thrilled to have you with us. I would like you to take this to heart. This is extremely frustrating. To me, this looks like a lot of arrogance. I'm afraid that sometimes physicians are very focused on their own specialties. They are blind to what is going on outside of that specialty. And they're not always listening to what their patients are saying. And I think that's very patronizing, and I'm afraid that's what's happened here. So, thank you very much for listening, and I will keep you abreast of what happens. Thank you very much. Bye-bye.